Horses change lives. They give our young people confidence and self-esteem. They provide peace and tranquility to troubled souls. They give us hope. In riding a horse, we borrow freedom. Helen Thompson. Dakota, a 20-year-old quarter horse, is a horse who was recently paired up with a 6-year-old girl named Claire who has spastic diplegia cerebral palsy, or SDCP. What were they paired up for? They were paired up to participate in hippotherapy. Hippotherapy dates back to Greece and is recorded in medical literature to have been prescribed for people suffering various things such as cerebral palsy, head injuries, stroke, multiple sclerosis, depression, and others. It is a unique therapy utilizing horses as the primary tool to rehabilitate their human riders. The treatment is led by physical, occupational, or speech therapists. The primary goal is to improve posture, mobility, function, and balance. Posture is improved by increasing muscular strength in the abdominals and back. Mobility refers to the ability of the patient to move about as desired, and function refers to how well patients can complete activities of daily living, such as tying one's shoes and getting dressed. SDCP is also known as Little's disease, and is the most common type of cerebral palsy, affecting 70 to 80% of all cases. It occurs between 3 months of age and 2 years. Symptoms include paralysis, abnormal gait, abnormally high muscle tone or hypertonia, difficulty reaching, poor abdominal and back strength or core strength, and it tends to affect the legs more often than the arms. Patients are affected with muscle spasms and can have trouble fine-tuning their muscles to complete tasks such as reaching for a glass of water. How does hippotherapy benefit the rider? The rider sits astride the horse and feels the movement, shifting of weight and direction, warmth and energy from the horse. Patients that are confined to a wheelchair do not get to exercise the muscles involved in walking. Since the horse's gait mimics the walking of a human, the rider's pelvis moves in much the same way as it would with walking. Therefore, those muscles are stimulated. Children with SDCP have poor hip flexibility and high muscle tension, and the warmth of the horse promotes relaxation and circulation in those muscles. Riding combined with other flexibility exercises, such as reaching for a horse's tail or brushing the mane, helps to increase flexibility. Riding a horse isn't smooth, and the lack of smoothness forces the rider to work to keep their head stable and their body centered in the saddle. This activates those muscles to complete those actions. These muscles gain strength, and the result is a child with better posture, balance, and confidence. A study called Changes in Dynamic Trunk and Head Stability and Functional Reach After Hippotherapy was conducted in 2009. The purpose was to determine if hippotherapy could alter the trunk and head stability of children with SDCP. 11 children with SDCP ages 5 to 13 years old participated as experimental group, and 8 children without disabilities were the control group. The children with SDCP had no prior riding experience. Each child is matched with a therapy horse who is led by an experienced horse leader. They are strictly in charge of the horse and must keep the horse calm at the correct pace and must direct the horse correctly. On each side of the horse is a person called a sidewalker. They support the legs and the lower hips to keep the child stable. Each session lasts for 45 minutes, 1 time a week for 12 weeks. The sessions consisted of various speeds of walking or trotting. The children would switch into various positions, such as pushing their hands down on the saddle or pressing their feet in the stirrups. Games and activities were also utilized, such as trying to toss a beanbag through a hoop while walking or throwing and catching balls. Stretching activities were done, such as trying to reach the horse's ears, and cognitive games, like remembering where items in the arena were hidden, exercised the cognitive abilities of the children. Pre-testing and post-testing were consistently conducted. The researchers used a video motion capture device to measure results. A mechanical barrel that mimicked a horse was used to test the trunk or core strength and head stability. The researchers measured the amount of movement made by the children when the barrel made various movements. This chart shows how the head stability improved for the children over the course of the study. A second test is called the functional reach test. The children sat in a box and completed this test that evaluated the ability of the children to correctly reach certain targets. To see these results, 19 reflective surface markers were placed in the children so the 6 cameras could capture the results. The results were positive between the pre-test and the post-test. The children with SDCP improved their trunk strength, head stability, and reaching abilities. Along with these results, parental observation observed that the children's speech, self-esteem, and emotional well-being improved over the course of these treatments. This study concludes that hippotherapy has positive effects on children with SDCP in helping them to rehabilitate. Thank you.